Good morning. Make sure you know everyone who's here. Some of you are forgetful. From my far right, Robert Mihiga, Director of the Budget. Immediate right, Melissa DeRosa, Secretary to the Governor. My immediate left, Dr. Howard Zucker, Commissioner of the Department of Health. To his left, Jim Malatras. If you ask him a question and expect a response, you have to refer to him as Chancellor Malatras, otherwise he does not respond. It's just a transition period. To his left, Gareth Rhodes, who is the Deputy Director of Department of Financial Services, but has been working with us on COVID. This is a little different today. We will be joined by a number of participants on Zoom, and we'll hear from a couple of them after the presentation. It's a different phase that we're entering now, and we've been working on it over the weekend, and this is not working. There you go. I hope you all had a good Thanksgiving weekend. And a safe one. I hope you were not a turkey. We've been spending a lot of time talking to hospital administrators, local officials all across the state this weekend to design a strategy going into this new phase, because we're all seeing new facts. Today's day 275. And it's a new phase in the war against COVID. The war against COVID, because I think of this as a war. You know, it's a war of attrition. It's a war in terms of preparation and mobilization. It's a war in terms of mindset. COVID is an enemy that we're dealing with. It's attacking people. It's killing people. So I talk about it and think about it in terms of a war. And the war changed. Sun Tzu. Just as water attains no constant shape, so in warfare there are no constant conditions. He who can modify his tactics in relation to his opponent thereby succeeds in winning. When the facts change, when the attack changes, change your situation and your defense or offense. COVID is shifting the battlefield dramatically, and we have entered a new phase. Came with the colder weather. All the experts talked about what was going to happen when we reach the fall, right? Cold weather, more people indoors, more people are now traveling. There has been a change in behavior among people. They've been informed, they've been educated, they've learned, they've changed their behavior. We have government policies on what businesses operate and how they operate, and that has had an effect. So the chessboard has really changed. And then we are coming into the holiday season, and the holiday season is going to have a profound effect. It already has. When people started to travel for the holiday season, when they started to travel for Thanksgiving, when students started to go home, when people started to shop, when they started to move around, increased mobility, increased social activity, increased viral infection rate. It is directly proportionate. And we talked about this before Thanksgiving. You are not just going into the Thanksgiving weekend, you're starting a 37-day holiday period. That's why Dr. Fauci over the weekend was talking about there's now going to be a surge on the surge. So we had a fall surge, my words. We now have a holiday surge on top of the fall surge. That's Dr. Fauci's surge on top of the surge. And it's not going to be a 1 or 2 day affair. It's going to be the entire holiday season, which is 37 days. Now, the mindset for the holiday season all right, we're now all happy and cheery, and we're going to come together, and we're doing gift buying, and we're going to do holiday celebrations. We're going to start to have meals together. The family's coming back together for the holiday season. Students are all coming home. Religious celebrations during the holiday season. Yeah, COVID is the Grinch. Think of it that way. And the COVID Grinch is an opportunist. And the COVID Grinch sees this as the season of viral transmission. All those things that the holiday season brings, they all increase social activity, they all increase mobility, and they will all increase viral transmission. So, this is the season of the COVID Grinch also. When you hear that holiday music, Marcia, dun, 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 think.
Did you sing it again?
Yeah, dun, 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 dun. Think COVID Grinch and be on alert, because that is part of this holiday season. We've also seen behavioral shifts by the policies that we put in place and by the data that we have received. The bars and restaurants protocols, we've seen a reduction in the level of spreads from bars and restaurants. We've seen a reduction in the level of spread from personal services, hair salons, etc. Gyms, we have seen somewhat of a reduced spread, not as dramatic as bars and restaurants or personal services. Mask wearing, great. New York, first state in the nation to have a mask mandate. Our mask compliance is up near 98%. Great. And all social action. The school protocols and the school testings, great. Highly effective. Astonishing how low the levels of infections are in schools, especially K-8. Really bad news, family gatherings and smaller social gatherings have exploded as places where the virus is spreading. So we understand the cause, we understand the effect, and we understand the effect is dramatic. And this is the bottom line on all of this. COVID rates go up. When the COVID rates go up, what happens? The hospitalization rate goes up. And the hospitalization rate is increasing dramatically. End of June, we're about 900. We're now at 3,500, okay? Since the end of June. And that is before feeling the effect of the holiday season. So, this, my friends, is the problem. And we are seeing the rise in hospitalizations all across the state. And it's not a situation where it's only happening in one part of the state, and then we can shift resources from one part of the state to the other. Remember, the first go-around, it was primarily New York City downstate. We had upstate resources that we could share with downstate. That is not the case this time. It is statewide. So we will have a limited ability to bring resources from upstate to downstate, like we did in the spring, or from downstate to upstate, because literally every region is dealing with a hospital issue now. And you look at those curves, they're all going up at an alarming rate. So in the new battlefield, hospital capacity is the top concern, period. It's about hospital beds, it's about ICU, and it's about having enough staff and enough equipment. That is the effect, and that's what we're going to have to deal with. We have 5 strategies that we are announcing today and that we are putting in place. First, we're going to shift the focus to the number of hospitalizations and hospital capacity. We're going to add to our zone designations, the yellow, orange, red, The hospitalization rate, we know by address where people are coming from who are going into the hospital. The death rate, the case rate, the available hospital beds in that community, the available ICU beds, and the available staff. We are now worried about overwhelming the hospital system. And if those numbers continue to increase, which we expect they will, you will see serious stress on the hospital system. So we're adding those factors into the equation. Also, the patient load management of that community, how effectively they're dealing with the patient load. Also, PPE and equipment availability. Everybody remembers the nightmare of what we went through with PPE and equipment. We are going to set specific metrics for each one of those factors. I want to wait and see what the numbers are post-Thanksgiving. We don't know what the Thanksgiving effect has been yet. You sat at the dinner table with your in-laws. They said, don't worry, I've been very careful, I haven't been quarantined. Yeah. Doesn't have to be your in-laws. In-laws can be nice people. They're not the only people who can infect you. Thanksgiving, you'll see 3, 4, 5, 7 days until you see people who were infected during Thanksgiving or during Thanksgiving travel. So there'll be a week to 10-day lag before we see that number come to effect. We're also talking to the hospital administrators across the state. We want to know exactly where they are with their hospital today, with their capacity, with their PPE, etc. We learned this lesson the hard way. We have about 54,000 hospital beds in this state. We were told that we would need 120,000. We lived this nightmare. We learned from this nightmare. And we're going to correct for the lessons we learned during this nightmare. It was the first time ever the hospital system, which is essentially a private hospital system, needed to be managed governmentally. And that was a very difficult transition. But we learned from it. We're going to add, on top of yellow, orange, red, an emergency stop provision where if we hit a real hospitalization crisis, we could potentially do a New York pause. California just did a California pause, which is basically a stop, or move one zone to another if we have a critical hospital situation. Today, New York State Department of Health is going to initiate emergency hospital measures. Number one, every hospital has to identify retired nurses and doctors now. We're already experiencing staff shortages. Staff just gets exhausted after a while. They've had a horrendous year. To now go through this again with emergency rooms and a high number of COVID patients coming in. They start tired. They start sick. Start identifying retired nurses and doctors now. We did this last time. It worked very well. We're going to stop elective surgery in Erie County as of this Friday. Erie County has the most critical hospital situation in the state. So Erie County must stop elective surgery. Catholic hospital system in Erie County voluntarily stopped elective surgery just to be responsible. I thank them. It's now mandatory. They must all stop elective surgery as of Friday. Let's start to free up those hospital beds. If the situation continues to get worse, we'll stop elective surgery in other parts of the state also. Elective surgery are those surgeries that don't have to be done at that time, and we want available beds for COVID people, so stopping elective surgery does that. The individual hospital network load balancing is mandated as of today. Let me explain to you what this is. Talk about learning a lesson the hard way. There are hospital systems in the state that have a number of hospitals in their system, and they can be private or they can be public. Northwell has a number of hospitals in their system. Montefiore, ECMC, Erie County, URMC, Rochester, Kaleida, New York City, H&H. They are systems unto themselves. And they can have 7, 8, 10, 11, 30 hospitals in their system. It is mandatory as of today that they balance the load within their system. They balance patient load. So you distribute the patients among your hospitals in your system. The nightmare we went through last time was a hospital would be overwhelmed. But that system had other hospitals that had capacity. Well, then why didn't you shift patients from the overwhelmed hospital to the hospitals that had capacity in your own system? Well, that's not how we operate. Yeah, I get it. I learned that lesson. Forget how you operate. This is a mandate from the State Department of Health. You must distribute patients across your system so one hospital does not get overwhelmed. Well, the patients don't want to go to other hospitals. Then let's just end elective surgeries now, and we'll make it simpler. But no patient wants to be in an overwhelmed hospital because you're getting less care, the staff is stretched thin. It's in the patient's best interest, distribute the patient load over the system. We're not going to live through the nightmare of overwhelmed hospitals again. So those individual systems, they must do that now. If a hospital gets overwhelmed, there will be a state investigation. And if the result of that investigation is they did not distribute the patients, that will be malpractice on their part. This was a serious issue last time. It was a case of first impression last time. This time it's not a case of first impression. I don't mean to be difficult, but difficult is when people die because they didn't get the right health care. That's really difficult. So preparing for that is important. That goes into effect immediately. We also have to prepare emergency field hospital plans region-wide. Plan now for adding 50% capacity to your hospital. If you have 100 beds, you go to 150 beds. We did this last time. It was highly effective. We brought a system from 50,000 to a system of 75,000. Prepare to implement statewide Surge and Flex. Statewide Surge and Flex moves patients among systems, right? What I was just talking about was movement within the system, moving Kaleida patients within Kaleida facilities. Statewide Surge and Flex moves patients among different systems. So theoretically, a patient could go from NYU Langone to Mount Sinai. You move them among different systems. That's a different level of coordination with a different level of emergency. And prepare to staff the emergency field hospitals. Also confirm the PPE stockpiles. Department of Health did regulations as to how many PPE you needed. 90-day stockpile of PPE. Confirm that you have those PPE stockpiles in place because we don't want to run through that again. We'll be announcing a hospital capacity emergency tracking system that's going to track these metrics statewide. And that's the first initiative. Second is on testing. We do more testing than any state in the nation. We have the highest amount pro rata. I'm very proud of that. You can't do enough testing. The more testing you do, the more you know. And the more you know, the better you do. It is just that simple. Local governments, the state, hospitals have to work to increase the gross amount of testing, and we have to have a balanced distribution. We're trying to serve a lot of needs in a lot of populations. We have to test healthcare workers. We have to test the nursing homes. We have to test schools. We have to test essential workers. We have to test the business professionals where we put in a protocol that they have to be tested. We have to test the personal services protocols. And you have general population of students who come home. They want to make sure they're not infected. People just went to Thanksgiving. They get a cough. They want to know if they're infected. The localities have to distribute the testing equally or fairly among these groups. Essential workers, they're out there every day. The police, the fire, they have to be tested. There's not enough tests to go around. I get it. But we have to be fair in the distribution. And local governments have to work on coordinating that. Third, keep schools open. All the testing says schools are safer than the surrounding community. We focus on special ed K-8, doing testing in schools on a sustainable basis for long-term operation. If they're in an orange or a red zone, the state mandate is 20% over a month. Red zone 30% over a month on a rolling basis. They're doing weekly testing. They can pool test. Again, we're very aware of the need to balance the tests because a lot of people need tests. The local district can exceed the minimum state testing level, but they have to make sure that they are meeting their other needs also. It's not enough to test all students and not test essential workers. Test all students, but not test all nursing homes. Test nursing homes, but not test schools. You have to fairly distribute the tests. We've talked to all sorts of experts all across the country. No state has the testing school protocol that we have in place. No state and no city. So we feel good about that. We have a mandatory close level for school districts. School districts can close lower than the state threshold. We've gone through that in various parts of the state. Our advice is you don't. We believe in keeping especially K-8 open. The schools are safer than the surrounding community, and children get an education, and parents can work, etc. But we understand local school district prerogative. They can close below our level. The small gathering spread is now the #1 spreader, about 65% of all cases. This is a dramatic shift. Part of it is the holidays. It's what happens during holidays. Part of it is reduced social options. I can't go to the bar and hang out. I can't go to a restaurant and hang out. I can't go to the movie theater and hang out. Come over to my house and we'll hang out. It's just an adaptation of social behavior to the circumstance. We have a rule in effect, no more than 10 at an event. These are all the states that have rules of no more than 10. People say, oh, I can't believe the New York rule, no more than 10. Many states have a rule of no more than 10. And by the way, Kentucky just announced they're going to a rule of no more than 8. This is a nationwide problem. I understand that people say, I don't like the restrictions, I have COVID fatigue. How can you say I shouldn't have more than 10 people in your house? Look, the truth is government doesn't have an ability to monitor it. But you want to know what is smart? what is reasonable, what is protective of other people and yourself. This is where the spread is coming from. It's a small gathering spread. We have to communicate this now to people the way we communicated masks. Seemingly the safest place, my home, my table, my family. Yeah, even that place is not safe. And we're going to have a new public education campaign that speaks just to this. This is not government being overly dramatic. These are just facts. And look, I've heard the political back and forth. Oh, this is Democrats saying this. First of all, this is probably the only issue President Trump's people and Joe Biden's people have agreed on. Both of their health advisors say small gatherings are the problem. The CDC, under Trump, the regulation was no more than your household for Thanksgiving. That's what the CDC said. So all those people who want to say, well, this is political, I'm standing up against it. Your president, President Trump, his administration said do it. And Joe Biden's administration, health advisors, said the same thing. So whose politics are you playing? If Donald Trump says the CDC mandates it, and Joe Biden's advisors say it's smart, whose politics? Your own politics? You're waving the political flag. Whose flag are you waving? It's agreed to by both. It's a fact of being smart. And luckily, most of us are smart. I had a conversation with someone over the weekend. Well, nobody's going to tell me how many people to have in my house. It's my house. I want to have my family over. I can have my family over. I said, you're right. I said, I'll make a deal with you right now. You do whatever you want in your house. Invite whoever you want. But here's the deal. If somebody gets sick from what you did, you handle it. He said, what do you mean? I said, don't call an ambulance and expose an ambulance driver. Don't go to the hospital and expose a nurse and a doctor and an 1199 worker because you wanted to be reckless. You handle it. Stay at home and take care of yourself. But don't expose people and don't ask people to risk their lives because you undertook risky behavior. Oh, no, I won't agree with that. I said, oh, I see. So you want to be able to behave in a risky way, and then if you get sick, then other people have to risk their lives because you were risky. Is that fair? But that's what they're asking. Well, I'm going to stand up. You want to be a tough guy? Guy being gender neutral? I'll tell you what a tough guy does. Go volunteer in a field hospital in Staten Island and help COVID patients if you're a tough guy. You want to celebrate Thanksgiving? Bring your whole family and your extended family and go volunteer in a hospital and help COVID people. That's how you celebrate Thanksgiving. Don't create more COVID positive people and then expect other people to come to your rescue. That's not the spirit of Thanksgiving. Vaccinations, that is going to be the weapon. That is going to be the weapon that will end the war. The only question is when. We're going to be very robust and aggressive on the vaccination program. We're building it around fairness, equity, and safety. We're going to have a very inclusive process. I'm reaching out with other governors to the federal government, which is not now funded, a black, brown, poor community outreach program for the vaccine. Blacks died at twice the rate that whites died. Brown died at 1.5 times the rate that whites died. They are less served by the healthcare facilities. We need a special outreach effort. Federal government has provided no funding to do that. There are also concerns with the undocumented community that they're not exposing themselves to legal action. So we're working through that. But the vaccine critical mass is still months away. And until the vaccine hits critical mass, keep operating at the maximum safe level. We want the economy open. We want people working at the maximum level that is safe. So to recap, it's about hospital capacity, increase in balance testing, keep schools open. Small gatherings are the #1 cause, and we have to alert the public. Small gatherings are difficult. It's not about government enforcement. Government is not capable of enforcing what you do in your home. But again, it's people being smart, and we're getting ready for vaccine distribution. Personal opinion, if I have to wager, you'll see these numbers continue to increase all through the holiday season, probably till mid-January. You have not yet seen the effect of Thanksgiving. There will be a lag, and you will see the effect a week out from today. But I expect those numbers will continue to go up. If I'm really going out and on a limb, I would say, guess, you start to see a stabilization mid-January at a higher rate raised by the holiday season. After New Year's starts to settle down, you see the rate stabilize. But the rate will be much higher than it is today. That's why it's about the hospitalizations. You won't see a real end until the vaccine hits critical mass. And I would wager today you won't see that until late spring, early summer. At the current rate, could change. So we have to settle in, but the good news is New York is doing better than almost any other state on the numbers. New York is better prepared than any other state. And it is all in our control. It's not in your control, but it's in our control. This is all a function of human behavior and social action. It's all what we do. If you wanted to get the rate to 0 virtually, you could do it if you all agreed to a certain behavior pattern. We have to work, we have to function, but it's all in our control. Good news, I believe in New Yorkers. They did this before at a much harder level with less notice, and we'll do it again. But we have to do it. We see the goal line, we just have to get there. Today's numbers, microcluster areas 6%, statewide without microcluster 4, with microcluster 4.5. Test results 148,000, 54 people passed away. They're in our thoughts and prayers. Hospitalizations are up to 3,500. ICU up to 681. Intubations 325. Tough times don't last because tough people outlast them. Who said that? Marcia Kramer.
What's his name? Your father's favorite person.
A.J. Parkinson. You're right. You get the first question.
Because I've heard A.J. Parkinson.
At one point.
So I actually have.
Oh, I'm sorry. You still get the first question. But we have a number of guests who are with us on the Zoom call, and we're going to hear from a couple of them. We're going to hear from Ken Rasky and Mayor Bill de Blasio and County